Palliative care is, number one, it's one of the newest specialties in healthcare. It's a specialty that focuses on treating the physical, the social, the emotional, the spiritual, the practical, even the ethical aspects of a serious illness care journey. It's sometimes confused with hospice. I think it's very important that people understand that unlike hospice, in which a patient must give up disease-directed treatments, palliative care patients may continue their disease-directed therapy. Because of this confusion between hospice and palliative care, we prefer to use the term supportive palliative care. And in fact, we helped write that into Texas law several years ago. The first journals of palliative medicine don't come about until the mid to late 80s. The first board certification exam in palliative medicine doesn't come about until the late 90s, early 2000s. And so, yes, there was this period of time where nobody was educated about dying, about death, about opioids, about ethics. It just wasn't part of the curriculum. But I would say over the past 10 to 20 years, especially the past 10 years, there's been a tremendous change, and there's great education in medical schools and residency programs and fellowship programs across healthcare systems, certainly like our healthcare system, on all things palliative. Those little ripples from each individual working independently can coalesce to form a wave, and there's been this wave of change in how we approach serious illness, but the mortality rate remains 100%, and the kinds of things I saw in the 70s, in the 80s, are disappearing, in many cases thankfully have disappeared because of those individual acts of courage that nurses, social workers, chaplain, other doctors made. I feel fortunate to have been part of that. That's what history teaches us. When we come together, we can do so many more great things than any one of us acting alone. Thank you to the Dallas Historical Society for honoring me with this award and really for honoring our field. I accept it on behalf of all those who've worked to advance palliative care over the decades. Thank you.